Welcome to the Healthcare Authority's Hospital Presumptive Eligibility Training. Throughout our training today, we'll refer to Hospital Presumptive Eligibility as HPE. This online training is for designated hospital staff to learn how to complete a determination of eligibility for the HPE program when you are not able to help an individual complete a full application for healthcare coverage in the Health Plan Finder web portal. This training is one of 5 steps required to become an HPE determination specialist. Let's review our scheduled training in more detail. Today, we will cover the following topics: hospital requirements, healthcare authorities' role, applicants' rights and responsibilities, and accountability. Let's begin by reviewing what hospital presumptive eligibility is. Hospital Presumptive Eligibility, or HPE, is mandated per Section 2202 of the Patient Protection and Affordable Care Act and allows hospitals that are a state's Medicaid provider to determine eligibility for temporary Washington Apple Health. Hospitals have the option to participate in the HPE program, and the state will allow any hospital that is interested and qualified to participate to do so. The hospital is not reimbursed for completing an HPE determination. The purpose of the HPE program is to provide timely access to necessary healthcare services, immediate and temporary medical coverage while full eligibility is being determined, a pathway to longer-term Apple Health coverage for any individual, including someone not admitted or seeking hospital services at the time of the HPE determination, and an eligibility determination that requires minimal eligibility information prior to approval. HPE allows to be reimbursed for services provided during the temporary coverage period, even if later the individual is ultimately determined ineligible for Apple Health. The scope of care and cost of reimbursement under HPE is in accordance with rules specified in WAC 182-501-0060. All services must be rendered in accordance with policies in the Chapter 182 WAC. The scope of care under HPE is the same as any full determination of Washington Apple Health, with the one exception of pregnant women. Pregnant women are only covered for ambulatory prenatal care under HPE. Any labor and delivery costs are not covered. However, if the individual is later determined to be eligible for Apple Health, any labor and delivery costs will be covered for up to 3 months retroactively. It is highly recommended that the hospital has the pregnant woman submit a full application at the time medical benefits were first provided. Newborns who were born to women during the HPE coverage period are not automatically eligible for newborn coverage under Apple Health. A separate HPE determination will need to be made for each newborn who is seeking coverage. If a woman is retroactively determined eligible for the full Apple Health benefits, the newborn will then be eligible for the Apple Health newborn coverage for 1 year. Coverage begins with and includes the day in which the hospital makes the HPE determination. The HPE coverage will end on the date the state makes a full Apple Health determination, including approval or denial, or the last day of the month following the month in which the hospital makes the HPE determination, if the individual has not filed a full application by that date. Let's review a couple examples. In the first example, the hospital determines an individual presumptively eligible on the 3rd of February, and the client does not complete a full application. The HPE benefits will end the last day of March. In the second example, the hospital determines an individual presumptively eligible on the 3rd of February, and the client does complete a full application for Apple Health and is found ineligible for ongoing coverage. The HPE benefits will end the last day of the month after the individual has been provided 10-day advance notice that Apple Health coverage has been denied or closed. Individuals are only allowed one HPE determination in a 24-month period. This is calculated from the last day of the most recent HPE period. The one exception to this rule is for pregnant women. Pregnant women are eligible for an HPE determination once for each pregnancy.
To be eligible for HPE, an individual must be a resident of Washington State, meet citizenship and immigration requirements for each program, not already approved on Apple Health, under the age of 65 and not eligible for Medicare, and have household income at or below the limit of the program that qualifies them. Income limits for the HPE Apple Health programs include the following federal poverty levels, also referred to as the FPL. Children up to age 19 with income up to 312% of the federal poverty level. Note, children with income over 210% of the FPL are subject to a $20 or $30 monthly premium and cannot have creditable health insurance to be eligible. Pregnant women up to 193% of the federal poverty level. Parents, caretaker relatives up to specified amounts per household size. These income limits are listed on the HPE worksheet. Adults age 19 to 64 who are not receiving Medicare up to 133% FPL. Family planning services up to 260% of the federal poverty level. Former foster care children who turned 18 while living in Washington up to age 26 with no income limit. No AEM eligible individuals are eligible for HPE. AEM stands for the Alien Emergency Medical Program. For all these programs, an automatic 5% of the FPL deduction is applied before comparing to the limits above. There is no asset or resource test required. Note, you will all be receiving electronic copies of the HPE worksheet after this training. Hospital presumptive eligibility does not include the following groups: individuals who are over the age of 65, blind and receiving Medicare, disabled and receiving Medicare, individuals needing treatment for breast or cervical cancer, and other Medicaid state plan eligibility groups or populations covered under demonstrations or waivers. This includes any AEM coverage. If you have individuals that fall into these groups, refer them to DSHS or Washington Connection to apply for benefits. For any individuals with breast or cervical cancer, please refer them to the Department of Health. Let's move on to hospital requirements. To become a qualified HPE determination site, a hospital must notify HCA of their decision to become a hospital presumptive eligibility determination site, be enrolled with Apple Health as a participating provider, sign an HPE agreement to make HPE determinations consistent with HCA policies and procedures, collect and provide baseline data to assist HCA in determining effective criteria to develop quality standards and meet those quality standards once they are developed and implemented. To become a qualified HPE determination site, the hospital must designate hospital staff. These staff must be a registered in-person assister, certified application counselor, or an HCA community-based partner to have privileged access to Health Plan Finder, which includes a unique username and password. If staff do not currently have access to Health Plan Finder, also referred to as HPF, they must take the HCA community-based training online prior to participating. Once staff have been granted access to Health Plan Finder, they must complete this required HPE training. Lastly, designated staff must establish an HCA Views database account, which is used to submit HPE determinations. Designated staff must also be direct employees of the hospital. HPE determinations may not be made by individuals or entities that may assist with applications for regular Apple Health coverage if they are not direct hospital employees. This includes any hospital contractors or vendors that may assist the hospital. These vendors cannot participate as they are not Medicaid providers like the hospitals. When processing an HPE determination, the first step that you will want to take is to check Provider 1 for current Apple Health coverage. If there is active coverage in Provider 1, you will not want to make an HPE determination. If the client is not currently covered, attempt to begin a full application for Apple Health in the Health Plan Finder web portal. If you are unable to complete the full online application, use the minimal information required to determine presumptive eligibility. If you are having difficulties and it is during normal business hours, please contact designated HCA staff to troubleshoot applications in Health Plan Finder. We ask that you refrain from using presumptive eligibility as a way to resolve error codes and follow your normal processes for resolving errors and technical issues. The information required to make an HPE determination includes the following: the applicant's full legal name and date of birth, family household size, the household's gross monthly income, is the individual a Washington State resident, is the individual a U.S. citizen, U.S. national, or a qualified non-citizen, or has the individual had a previous HPE determination at your facility within the last 24 months. To make an HPE determination, you also need the following information. Is the client currently pregnant? If so, when is the pregnancy due date? Was the individual a foster child at the age of 18 in Washington State? Is the individual currently receiving Medicare benefits? If the client is currently receiving Medicare, they are not eligible for the Apple Health for Adults program. And if the client has other creditable insurance, they will not be eligible for Apple Health for Kids with premiums, also known as CHIP coverage. Use the information from the HPE worksheet to determine HPE eligibility. The worksheet includes information regarding what income to count and who to include in the applicant's family. If determined eligible, provide the individual with HCA contact information to follow up on getting full coverage approved. Inform the individual that they will need to follow up on a full application with HCA in order to obtain ongoing Washington Apple Health coverage. To communicate HPE approvals, you will use the Fuse web portal. You will give the individual either a notice of approval or a notice of denial form based on your HPE determination.
The following information needs to be filled out on the notice of approval for each individual: the client's name, date of birth, and Health Plan Finder application ID number, the hospital name, provider, and date of notice. The date of notice is the eligibility approval date. The notice of approval includes a statement of HPE policy. All determinations are final, and the individual does not have a right to appeal an HPE decision. Lastly, you will need to include your signature as the hospital representative with your title and contact information. This approval notice will be proof of coverage for this individual until they receive their Provider 1 card. Here is an example of what the first page of the notice of approval looks like. Here is the second page of the notice of approval letter. This lists the HPE rights and responsibilities. Any approved HPE determinations will need to be communicated to HCA through the FUSE portal. Once you have completed your training and HCA has received the hospital's signed contract, each individual will be granted access to the FUSE portal. This information will be emailed directly to you. After you log into FUSE, this screen will appear for you to submit your HPE determination. You will want to correctly fill out the fields and electronically attach the HPE worksheet and HPE approval notice for each individual client. You have 5 calendar days from the date of the HPE determination to submit it through the FUSE portal. If you determine that an individual is not eligible for HPE coverage, you will provide the individual with a notice of denial. The notice of denial includes the following items: client name, date of birth, and Health Plan Finder application ID number, hospital name, provider, and date of notice. The date of notice is the date the HPE determination was made. Statement of HPE policy, as the individual will have no right to appeal the HPE decision. And lastly, the notice of denial will include the hospital representative's signature, title, and contact information. Any HPE determinations that result in denial should not be entered into the FUSE portal. Here is a sample of what the notice of denial looks like. Now let's move on to the role of healthcare authority. When HCA receives an application for HPE coverage, an initial screening will be done to confirm the following criteria: the hospital and its representative are qualified and approved to determine HPE, the individual is not currently receiving Apple Health coverage, and the individual is not currently receiving or has not received coverage under HPE in the last 24 months. If the previous criteria are met, HCE will not question the eligibility decision unless the determination comes from a non-qualified hospital or the individual has already been approved for full Apple Health coverage. HCA will, under no circumstances, reverse an HPE decision. Also, HPE decisions cannot be terminated retroactively. This includes if someone determined for HPE is later denied for coverage based on a full application determination. When an individual is approved for HPE coverage, HCA will enter the eligibility information into the Health Plan Finder and send out a Provider 1 services card to the applicant. HCA will attempt to get a full application from the individual and make a determination for ongoing Apple Health. If the individual is found eligible for ongoing Apple Health coverage, HCA will ensure they are enrolled into a managed care program as appropriate. HCA will ensure that if a full Apple Health determination is not made, that the HPE benefits end on the last day of the month following the month of the HPE determination. When the HPE coverage ends, the client will not receive a notice that the coverage has ended. The notice of approval received from the hospital serves as a notice that the HPE coverage is temporary and will end within 2 months of the approval date.
Let's move on to the applicant's rights and responsibilities. It is the responsibility of the individual to provide true and accurate information when applying for HPE benefits. If approved, it is the client's responsibility to pursue ongoing eligibility by completing a regular Apple Health application prior to the HPE end date. If the individual is denied for HPE coverage, they have no obligation but may complete a full application for Apple Health coverage. Just to reiterate, all HPE determinations are final, and the individual does not have any rights to appeal an HPE determination. Next, we'll discuss accountability. HCA requires that the hospitals maintain a copy of the following documents for 3 years. The HPE worksheet that was used to determine eligibility for each individual, any issued notice of approval for each individual, and any issued notice of denial for each individual. HCA will track and record the number of applicants statewide and by hospital representative who completed a regular application for Apple Health within the required time frame, which individuals are ultimately approved and determined eligible for Apple Health, and any individuals who are ultimately denied or determined ineligible for Apple Health. HCA will also track and record all claims and payments related to HPE approvals for individuals who are ultimately eligible for Apple Health and any individuals who are ultimately denied or determined ineligible for Apple Health. As hospitals begin to submit HPE determinations, HCA will develop and implement standards to assess the number of HPE applications submitted, the proportion of individuals approved for HPE who follow up to complete a regular application for ongoing coverage, and the proportion of those approved for HPE who are determined eligible for ongoing benefits. HCA will also develop and implement standards to assess the accuracy rate of hospitals' determinations when individuals complete a full Apple Health application, and hospitals' participation in the process of collecting and reporting data as described in their HPE agreement with HCA. Over time, as HPE progresses and the standards for accountability are refined, HCA will enforce standards as follows. Create a plan of correction with the hospital. If a hospital is not meeting the prescribed standards for a period of 1 calendar quarter or longer, HCA will establish a plan of correction with the hospital. The plan of correction will include targets and timelines for improvement, steps to be taken in order to comply with performance standards, additional staff training if needed, and measurements for performance outcomes. HCA may impose additional plan of corrections for additional periods of time as appropriate to improve standards. If targets are not met after a sufficient period of time, as agreed upon with discussions between the hospital and HCA, HCA may disqualify the hospital from making HPE eligibility determinations. On an ongoing basis, HCA will provide access to training to become an HCA community partner for any staff that do not currently have other health plan finder access, for an example, an IPA, HPE training online for hospitals that would like to participate in the program, ongoing HPE training on an as-needed basis, technical assistance from HCA staff to complete an application for ongoing coverage and for temporary HPE coverage.
Congratulations! You've now completed the Hospital Presumptive Eligibility online training. Please notify HCA that you have completed this training by emailing hpe@hca.wa.gov. You are now ready to establish a FUSE account to complete HPE determinations. All questions regarding HPE may be directed to hpe@hca.wa.gov. Thank you for participating in the Hospital Presumptive Eligibility Program.